Here is something that sounds too simple to be true. 1 cup of a solution you can mix together in your kitchen right now, rinse with it for 60 seconds, and bleeding gums that have been bothering you for months start to calm down within days. Not weeks, days. And your teeth, your enamel, your gum tissue, none of it gets damaged. None of it gets burned or stripped or weakened. In fact, your whole mouth feels cleaner, fresher, and healthier than it has in years. Like you finally gave it exactly what it needed, and nobody ever told you what that was. This is not clickbait. This is not some miracle cure. This is biology. And once you understand why this works, once you understand what is actually happening inside your mouth when your gums bleed, you are going to wonder why nobody explained this to you sooner. And then you are going to stop wondering. Because you are going to know exactly why. The oral care industry is a multi-billion-dollar machine that profits from your confusion. It profits from selling you electric toothbrushes at $200, specialty toothpaste at $15 a tube, whitening kits at $40, and prescription-strength rinses that cost more than some prescriptions. And none of those things address the actual reason your gums are bleeding in the first place. The solution I'm going to walk you through today costs somewhere between 50 cents and $2 per month, depending on what you already have in your kitchen. You have probably walked past it in the grocery aisle 100 times without ever connecting it to your gum health. It has no marketing budget. It has no celebrity endorsement. It has no slick packaging with a smiling dentist on the front. It just works. And by the time this video is over, you are going to understand exactly why it works, how to use it correctly, and what to watch for so you know it is doing what it is supposed to do. But before we get into any of that, do one thing right now. Share this video before you watch another second, not at the end. Right now. Because someone in your life, a parent, a spouse, a sibling, a close friend, is dealing with bleeding gums, and they do not know that the answer might already be sitting in their kitchen cabinet. One share takes 5 seconds, and it could save that person months of discomfort and hundreds of dollars. Share it now, then come back, and we go through everything together. Now let's talk about what is actually happening when your gums bleed. Because this is the part most people skip, and it is the part that matters most. Your mouth is home to hundreds of species of bacteria. That is normal. Your mouth is supposed to have bacteria in it. The problem starts when a specific category of bacteria, the anaerobic kind that thrive in low oxygen environments, start accumulating in the tiny gap between your gum line and your teeth. That gap is called the gingival sulcus. It is a natural space, usually between 1 and 3 millimeters deep in a healthy mouth. When harmful bacteria colonize that space and are not disrupted regularly, they produce toxins and acids that irritate the gum tissue. The gum tissue responds by becoming inflamed. Inflamed tissue is fragile tissue. Fragile tissue bleeds easily. That is why your gums bleed when you brush. That is why they bleed when you floss. The bleeding is not caused by brushing too hard. The bleeding is caused by inflamed, fragile gum tissue that has been under bacterial attack. Brushing just reveals the inflammation that is already there. And here is what makes this matter beyond your mouth. Chronic, long-term gum inflammation, which dentists call gingivitis, does not stay contained to your gums. Research has linked it to cardiovascular issues, elevated blood sugar, and systemic inflammation throughout the body. Bleeding gums are not just a cosmetic issue. They are a sign that something is happening that your body is actively struggling to fight. And here is what the oral care industry does not want you spending too much time thinking about. Most products marketed to you for gum health are either cosmetic, meaning they make your breath smell better without addressing the bacterial root cause, or they are so chemically aggressive that they disrupt your entire oral microbiome, wiping out beneficial bacteria along with harmful ones. Alcohol-based mouthwashes are the biggest example. They do kill bacteria on contact, but they kill everything indiscriminately. They dry out your oral tissues. They disrupt saliva production. Saliva is one of your mouth's most important natural defenses against bacterial overgrowth. When you strip it away twice a day with a high alcohol rinse, you are not protecting your gum health. You're undermining it while making your mouth feel temporarily clean. That feeling is the product working on your perception, not on your bacteria. So what actually addresses the bacterial load at the gum line without destroying everything else in the process? There are 3 ingredients, all of them available right now at any grocery store or pharmacy, all of them cheap enough that the cost is nearly irrelevant, and all of them backed by research that the oral care industry has had very little financial reason to put in front of you. The first ingredient is salt, specifically non-iodized sea salt dissolved in warm water. This sounds almost embarrassingly simple, and I understand that reaction. When something costs 25 cents and has been sitting in your kitchen your entire life, it is hard to believe it might be doing something a $15 specialty rinse cannot. But here is what salt water actually does and why it works on bleeding gums. Salt water is a hypertonic solution. What that means in plain English is this: it has a higher concentration of dissolved particles than the fluid inside bacterial cells. When bacteria in your gum tissue encounter a hypertonic solution, osmosis pulls fluid out of their cells. This dehydrates and kills them. Salt water is also mildly alkaline, which creates an environment that anaerobic bacteria find inhospitable. They thrive in the slightly acidic environment their own metabolism creates. Disrupt that pH and you disrupt their ability to colonize. Salt water also draws excess fluid out of swollen, irritated gum tissue through that same osmotic effect. Swollen tissue that has had fluid drawn out of it is less fragile. Less fragile tissue is less likely to bleed. The formula is simple: half a teaspoon of non-iodized sea salt dissolved in 8 ounces of warm water. That is your base rinse. Stir until the salt is completely dissolved. Do not use more salt than that. A solution that is too concentrated can irritate your gum tissue rather than soothe it. Half a teaspoon in 8 ounces. That is the ratio that has been used in clinical settings for generations before the branded rinse industry decided there was more money in a bottle. Rinse for 60 seconds. Not 30, not 10 seconds, and spit. 60 full seconds of active swishing, making sure the solution reaches the gum line on both the outer and inner surfaces of your teeth. Then spit. Do not swallow. Wait 5 minutes before eating or drinking anything. And here is something most people do not know. Do not rinse with plain water immediately after. You want the saline environment to linger in contact with your gum tissue as long as possible. A plain water rinse right after just washes away the residual effect you just spent 60 seconds creating. Do this twice a day, morning after you brush, evening after you brush. Within 3 to 5 days of consistent use, most people notice their gums bleed less during brushing. Within 2 weeks, many people notice their gum tissue looks different, less puffy at the edges, less red, more pink, more firm, more like healthy gum tissue is supposed to look. This is the osmotic and antimicrobial effect of salt water doing what it is designed to do when applied consistently to a problem that responds to consistent, gentle intervention. Stay with me because the second ingredient is the one that surprises people most. It is the one that seems least likely when you first hear it and also has the most interesting science behind it. Why has your dentist probably not mentioned any of this? It is a fair question. The honest answer is that the information reaching patients often flows through a pipeline shaped by what gets marketed and what gets sampled to dental offices. Saltwater rinsing is not a product. Nobody manufactures it. Nobody distributes it with a sales rep who visits dental offices and drops off brochures. So it disappears from the conversation, not because it does not work, but because nobody has a financial reason to push it forward. The second ingredient is baking soda. Sodium bicarbonate, the orange box that has been sitting in your kitchen cabinet without you ever connecting it to your gum health. Here is what baking soda does in your mouth. Baking soda is alkaline. Its pH sits around 8.3. Your mouth, particularly in areas of active bacterial activity and inflammation, tends to run acidic. The bacteria causing your gum problems thrive in that acidic environment. They create it through their own metabolic processes. When you introduce a strongly alkaline substance into that environment, you are not just killing bacteria on contact, you are restructuring the chemical conditions they depend on to survive. You are making your mouth inhospitable to them at a foundational level. They cannot adapt to alkalinity the way they adapt to many chemical antiseptics. It is not a drug, it is a pH shift, and pH shifts are much harder to develop resistance to than chemical compounds. Baking soda also has a mild mechanical abrasion quality that, when used correctly, helps disrupt the biofilm at the gum line. Biofilm is the technical term for the sticky community of bacteria that attaches to your teeth and gum tissue. You know it as plaque. Baking soda disrupts it gently without scratching enamel. There is peer-reviewed research published in clinical dental journals over multiple decades showing that baking soda-based oral care products reduce gingivitis markers more effectively than standard toothpastes. This research exists. It has been published. It is just not in your television commercials. How do you use it? Dip a wet toothbrush into a small amount of baking soda, enough to coat the bristles, and brush gently for 2 minutes, paying particular attention to the gum line. The baking soda will foam slightly and taste mildly salty and mineral-like. Rinse with your saltwater solution immediately after. Do not use baking soda more than 3 to 4 times per week. Every single day is too much mechanical exposure. 3 to 4 times a week gives you the alkalizing and biofilm disrupting benefit without over-scrubbing sensitive tissue. One critical warning: do not confuse baking soda with baking powder. They are not the same thing. Baking powder contains additional ingredients formulated for cooking chemistry. You do not want that in your mouth as a dental treatment. Pure baking soda only. Sodium bicarbonate. That is the only form that belongs in this routine. The third ingredient is where people are most skeptical, and I understand that completely, because when you hear this one, your first reaction is probably the same one most people have. That cannot be real. But the research on this goes back further than you might expect, and the mechanism is specific and documented. The third ingredient is coconut oil. What I am describing is oil pulling. It has been used for centuries in traditional medicine, and for a long time sat in the category of folk remedy that modern dentistry dismissed without much investigation. But in the last 15 to 20 years, clinical research has started catching up with what practitioners had been observing, and the findings are consistent enough to take seriously. Here is the mechanism. Bacteria in your oral cavity have cell membranes that are largely lipid-based. Lipid means fat. Oil is fat, like dissolves like. When you swish oil through your mouth, the lipid outer membranes of bacteria are attracted to and pulled into the oil. The bacteria literally get caught in the oil and removed from your gum tissue when you spit. Coconut oil specifically contains a high concentration of lauric acid, which has documented antimicrobial activity against the specific strains of bacteria most commonly associated with gingivitis. Lauric acid disrupts bacterial cell membranes directly, above and beyond the simple mechanical trapping effect any oil would produce. Studies published in dental research journals have found that consistent oil pulling with coconut oil reduces plaque and gum bleeding scores comparably to chlorhexidine rinse, which is the prescription-strength antibacterial rinse dentists prescribe for active gum disease. Here is how to do it correctly. Take 1 tablespoon of coconut oil, which may be solid at room temperature but liquefies almost immediately in your mouth. Swish it gently through your teeth and around your gums for 15 to 20 minutes. Gently. You are not aggressively gargling. You are letting the oil slowly work through every surface of your mouth. If your jaw gets tired, you are pulling too hard. Relax the effort. After 15 to 20 minutes, spit into a trash can, not your sink. Coconut oil can solidify in pipes and cause clogs over time. Spit into the trash. Then rinse with warm water and follow with your saltwater rinse. Do this first thing in the morning before you eat or drink anything. The morning is when bacterial counts in your mouth are highest because reduced saliva flow during sleep allows bacteria to multiply overnight. Oil pulling on an empty mouth first thing in the morning targets the bacterial load at its daily peak. 3 to 5 times per week is sufficient. Every single day is not necessary for most people. 3 to 5 times per week, consistently, over 3 to 4 weeks, is where the research shows the most meaningful reduction in gum bleeding and inflammation. Now let me put the complete system together, because these 3 ingredients work even better in combination than individually, and the sequence matters. Morning, before eating or drinking anything except water. Oil pull for 15 to 20 minutes. Spit into the trash. Rinse with warm water. Then brush with a small amount of baking soda 3 to 4 mornings per week and your regular fluoride toothpaste the other mornings. Then rinse with your half teaspoon of sea salt dissolved in 8 ounces of warm water for 60 seconds and spit. Evening. After your last meal, brush normally with your regular toothpaste. Floss gently, going just below the gum line without forcing the floss aggressively into the tissue. Then rinse with your saltwater solution for 60 seconds and spit. Do not eat or drink anything other than water for at least 20 minutes after. That is the system. Morning oil pull, baking soda brush, saltwater rinse. Evening regular brush, floss, saltwater rinse. Consistent. Every day, for at least 3 weeks before you judge the results. Here is what to expect in the first 2 weeks. By day 3 to 5, most people notice their gums bleed less during brushing and flossing. Not 0, less. By the end of week 1, many people notice the gum tissue looks slightly different, less puffy, less deep red, and more movement toward a healthier pink. By the end of week 2, many people notice their breath is genuinely different, not just temporarily masked by mint. The organic compounds that cause bad breath are largely produced by the same bacteria causing gum inflammation. Reduce the bacteria, reduce the breath issue. At the source, not cosmetically. Now let me be honest about what this system does not do. This system addresses gingivitis, which is early-stage gum disease characterized by inflammation and bleeding that has not yet caused damage to the bone structure supporting your teeth. Gingivitis is reversible. If your gum disease has progressed into periodontitis, where bone and connective tissue supporting your teeth have started to be destroyed, this system alone is not sufficient. Periodontitis requires professional intervention, deep cleaning procedures. In advanced cases, surgical treatment. None of these 3 ingredients will regenerate bone that has been lost. If a dentist has told you that you have bone loss or pockets deeper than 4 millimeters, please work with a dental professional. Use this system as supportive care alongside professional treatment, not instead of it. Also, a note about fluoride. Saltwater rinsing and oil pulling do not deliver fluoride. This system is designed to be used alongside, not instead of, your regular fluoride toothpaste. Keep using your fluoride toothpaste. Add this system on top of it. You get the cavity prevention benefit of fluoride and the gum health benefit of the 3-ingredient approach together. Before you go, leave a comment right now telling what your specific gum situation is. Bleeding when you brush, sensitive gum tissue, gums that look red and puffy, or something else. Describe it in the comments. It gets red and it shapes what gets covered next. Go make your saltwater rinse tonight. Start tomorrow morning with your oil pull. Give it 3 weeks of real consistency. Then come back and share what happened. Disclaimer: this video is for educational and informational purposes only. The content presented here reflects personal opinions based on information gathered from publicly available sources, including YouTube, Google, news articles, and general wellness content. Nothing in this video should be considered professional medical or dental advice, diagnosis, or treatment. Always consult a licensed dentist or qualified healthcare professional before making any changes to your oral health routine, especially if you have existing dental or medical conditions. The creator of this content is not a medical professional, dental professional, or licensed healthcare provider. Individual results may vary. Do not delay seeking professional dental or medical care based on anything presented in this video. One more thing worth addressing before this wraps up. because it comes up every single time this topic gets discussed online. If you go searching for natural gum care information, you are going to encounter a significant amount of misinformation and, in some cases, outright scams. Products being sold in bottles with impressive sounding names. Essential oil blends promoted as cures for advanced gum disease. Protocols that tell you to stop seeing dentists entirely and trust only in home remedies. Be extremely skeptical of any product claiming to reverse severe gum disease in days or weeks. Be skeptical of any seller pushing a subscription or auto-ship program for gum health supplements. Be skeptical of any protocol that tells you professional dental evaluation is unnecessary. The 3 ingredients described in this video are not sold in a kit. They are not branded. They do not require a subscription. They are salt, baking soda, and coconut oil. You buy them individually at the grocery store. If someone is trying to sell you a packaged version of these 3 things at a premium price online or in a health store, you are paying for packaging and marketing on something that costs almost nothing to put together yourself. Your gums do not need a subscription box. They need consistency and the right ingredients used the right way. That is it. Subscribe and turn on notifications, because the next video goes into what those numbers your hygienist calls out during your dental exam actually mean for your long-term gum health. Most people have sat through dozens of dental appointments and never understood what is being measured when the hygienist probes around each tooth and calls out numbers to an assistant. That information changes how you understand your own oral health completely. You do not want to miss it.